Cholera is a bacterium that resides within the small intestines after ingesting infected water supplies that have been contaminated by an infected individual's feces. The Vibrio cholerae cell is gram-negative, meaning under the gram stain procedure, the cholera cell will appear as a pinkish color instead of a purple. It is comma-shaped and has a pili and a flagellum at one of the cell poles. The Vibrio cholerae cell is facultative anaerobe, which means it can both undergo respiratory and fermentative metabolisms. Once cholera has reached the small intestines within the body, it causes a large loss in salt, water, and nutrients, flushed away with the fluids in an attempt of the immune system to rid the body of the pathogen. Infected individuals who experience extreme diarrhea within 12 to 28 hours of incubation, accompanied by vomiting. To clean out the top layer of the intestines of the pathogen. The patient's blood pressure will decline, the muscles cramp, and there's a major deterioration of physical features such as hollow or sunken eyes and wrinkled skin known as washerwoman's hands. The disease leads to extreme dehydration due to the loss of vital body fluids and nutrients for cell functioning and will eventually lead to death in 2 to 7 days if left untreated. From initial infection, there's a 2 to 7 day time period of opportunity for the treatment of cholera. Patients will come into health agencies, and in order to be treated for their lost nutrients and dehydration, doctors give oral rehydration using ORS, a mixture of glucose, sodium chloride, potassium chloride, and trisodium citrate. The ORS allows for cholera to be treated in adverse conditions and can be prepackaged easily and used by non-medical personnel. Antibiotics can also be used to lessen the intensity of the illness, but this does not help with the issue of dehydration. Although vaccines are in development and use, a good one has not yet been developed for the treatment of cholera, as the current ones are relatively ineffective and not generally recommended. There are a few very simple ways to prevent transmission of cholera suggested by the Center for Disease Control. Individuals in risk areas for cholera should drink safe water, wash hands often with soap and clean water, use appropriate waste disposal methods instead of defecating in local water sources, and cook food in clean water. Cholera outbreaks usually occur in areas where the public water supply is easily accessible to the general public, making contamination very easy. Carter, stop pooping in the gosh darn lake! Jeez, what is wrong with that guy? As I was saying, many third world countries such as India, Bangladesh, and various countries in Africa have a high cholera prevalence, with a global rate of roughly 3 million cases of cholera infections each year. Globally, 1.4 billion people are at risk of cholera. Currently, the World Health Organization, the Center for Disease Control, and UNICEF are working towards ending cholera outbreaks once and for all by 2030. Cholera outbreaks are mostly in areas that are third world countries, have internal conflicts, and are poverty-stricken. The poor economy and lack of unification under a government in these areas can make it a challenge for task forces to fight this disease. Some countries have teamed up with global agencies to fight cholera on a massive scale within their country. Establishing public health and sanitation policies within countries affected by cholera are the first steps towards limiting the spread of the disease. Since the disease is carried through contaminated water, governments must work with their plumbing and water distribution sectors to eliminate cross-contamination of water sources. Citizens need to be educated as well. Organizations and countries must work together to educate the public on appropriate health and safety standards to eliminate the spread of cholera. It is important to not contaminate public water supplies with feces, to always use healthy and clean water sources, and to always wash and stay sanitized.